Good morning, everyone. It's 11 o'clock. We'll go ahead and get started. I want to thank everyone for joining us today for the Rock County Public Health Department briefing. This is a weekly briefing that we do every Thursday at 11 o'clock. We do live stream it on our Rock County Public Health Department Facebook page. And afterwards, the recordings are available on our Facebook page and on our YouTube channel. So we will start out with some updates and some topical information, and then we'll open it up to our participating media partners for questions. My name is Jessica Turner. I am the communication specialist for the Rock County Public Health Department. And joining me today, I have Katrina Harwood, our health officer, Kelsey Cordova and Lori Soderberg, who are both public health supervisors, and Nick Zupan, epidemiologist. So I will first turn it over to Nick for some data updates.
Thanks, Jessica. So in terms of our case activity, we're still seeing ongoing declines in case activity. Yesterday afternoon, the official count was 14,565 total cases of COVID-19. And if you've been following our data, you may have noticed that this was 6 fewer confirmed cases than the day before. What happened is the state is in an ongoing process of data cleanup, and 6 cases that had been antigen positive cases were marked as confirmed, and they should have been marked as probable cases. So this kind of data cleanup is happening on an ongoing basis, and the state is actively doing this as there are fewer cases. They're ramping up their efforts in data cleaning, and so you may see some of these types of situations in the future where there may be slightly lower numbers than they were the day prior, and know that the reason behind that is we're just trying to make sure all of our data is as accurate as possible. So based on the number of cases that we're seeing, we're averaging about 7 new cases per day in Rock County, and that leaves about 131 active cases in the community right now. There have been 163 deaths due to COVID, and this is an increase of 1 over the last week. And most recently, we've had 4 patients in the hospital getting treatment for COVID-19. So we're still seeing low numbers of hospitalized patients. In terms of our vaccination numbers, we are seeing steady increases on a weekly basis of people getting vaccinated. Right now, we have over 35,000 Rock County residents who have gotten at least that first vaccine. And we have more than 22,000 Rock County residents who have completed the vaccine series. In terms of our older population, those who are 65 and older who have gotten the first dose, we're looking at about 19,500 individuals who've gotten that first dose and 12,000 individuals who've gotten the second dose. So we're up to 70% of our 65 plus population who've gotten at least 1 dose, and 43% of our 65 and older population who've gotten the full series. So those are great trends, and we hope to continue to see those increase. So with that, I'll turn it back over to Jessica.
Thanks, Nick. We'll next go to Katrina for some additional updates.
Thank you, Jessica. Just a couple updates. The State Health Department recently clarified current vaccine eligibility. So current vaccine eligibility does include all clergy as part of healthcare personnel who provide spiritual care to the sick, restaurant workers as part of the food supply eligibility group, and it also further expanded public safety to include judges, prosecutors, and other essential criminal court personnel, in addition to public defenders. The next vaccine eligibility group will begin on March 22nd. The date has been changed from the original date of March 29th. This new eligibility group includes individuals aged 16 and over with certain medical conditions. A list of the specific medical conditions can be found on the State Health Department's website, which is dhs.wisconsin.gov. The list does include individuals who have asthma, moderate to severe, individuals with cancer, COPD, diabetes, heart conditions, obesity, or overweight. Also, just a reminder, the Wisconsin National Guard has extended their support of the free regional testing site at Black Hawk Technical College through May 27th. That site is open on Wednesdays and Thursdays from noon to 5 p.m., and they are able to test anyone 12 months of age and older. If you are experiencing any COVID-19 symptoms, we encourage you to seek testing. Thank you.
Thanks, Katrina. Now, Lori Soderberg will be giving us some information about the fairly new CDC guidance for fully vaccinated people.
Thank you, Jessica. So who is considered to be fully vaccinated? Those people that have been vaccinated for that's 2 weeks after their second dose in a 2-dose series, for instance, Pfizer or the Moderna vaccines, or 2 weeks after they've received the single dose vaccine, which is the Johnson & Johnson vaccine. So with those people who have been vaccinated, what has changed? People who have been fully vaccinated then with those above guidance that I just gave, people can gather indoors in private settings with other fully vaccinated people without wearing a mask. You can also gather indoors in private settings with unvaccinated people from one other household. For instance, if grandma and grandpa have gotten vaccinated and they visit their grandchildren and their daughter-in-law and son, they can visit them without masks as long as that there is no one in the household that has increased risk for severe illness from COVID-19. If you've been around someone who has COVID, you do not need to quarantine from others for at least 90 days. That's the current guidance. Or you do not have to get tested either unless you have symptoms. If you do have symptoms, then you do need to get tested, even if it's within those 90 days. So what hasn't changed? In public settings, we want everyone, if they're fully vaccinated, to still continue to take the steps necessary to protect yourself and others by wearing a mask, staying 6 feet apart from others, avoiding crowds and poorly ventilated areas. And you need to continue to do this whenever you're in public, gathering with unvaccinated people, or when you're gathering with more than one household of people. We know that spring break is just around the corner and that we're still recommending that you should delay domestic and international travel. If you do travel, you'll need to follow the CDC recommendations for travel. And that usually includes being tested before you board a plane or when you come back from visiting anywhere, flying anywhere. You'll still need to follow all guidance with the CDC for travel, as well as any guidance for your workplace. We know that vaccines, the COVID vaccines are very effective at preventing COVID disease, especially with severe illness and death. But we're still learning how effective the vaccines are against the new variants of the virus that are starting to circulate in Wisconsin a little. And early data shows that these vaccines may work against those variants, but they could be a little less effective. We know that other prevention steps help prevent the spread of COVID-19, and those are the steps that are really important: the masking, the social distancing. We also know that these new CDC guidance does not change at all the guidance for the mask order, the current mask order in Rock County, which is still in place until May 5th of this year. Thank you, Jessica.
Thanks, Lori. So we will now open it up to questions. It looks like we only have one of our media partners attending today. So we have Ashley McCallum with the Janesville Gazette joining us, and it looks like she has a question. So go ahead, Ashley.
Hi, everyone. I wanted to see if this is something you kind of are in touch with at the moment. I was wondering if we're seeing a lot of demand still for vaccine within the 65 plus population, or if we think that we might be kind of approaching, the maximum, I guess, of the population who wants the vaccine. If so, are there any initiatives in the county to try to reach members of the older population who might be struggling with figuring out how to get an appointment? We know that there's technology issues, time issues, mobility issues, and just seeing if there's any kind of initiatives to help those remaining folks out.
I can go ahead and tackle the first part of the question. In terms of the requests that we're receiving from the health department, we still are on a daily basis getting requests from our population who are 65 and older to be put on the list to have their information shared with vaccine providers in Rock County. So we are still seeing some requests in that sense. And then in terms of kind of reaching that population, Laura, do you want to share a little bit about some of the efforts that are happening with the homebound population?
Sure. We do have currently some mobile vaccination teams that have gone out to people and vaccinating them in their home for those that are homebound and truly have mobility issues. They're not able to get to a vaccine site. We also have several things in the works as far as transportation and getting people to vaccination sites if they have problems with access to transportation. So we have some things in place. Again, if that happens, please give us a call. We have resources available to help you with that access to transportation. As well as I would say we are reaching out on a continual basis to vulnerable populations. We have several things in the works with people vaccinating at churches in the upcoming month. So we're very excited about some of those efforts going forward.
Great, thank you. Ashley, it looks like you have another question. Go ahead.
Yeah, I think this segues really well to kind of the end of the answer there that Lori was just giving. We've heard from people all over the place saying that finding an appointment can be intimidating or frustrating for some folks. And do you think there needs to be more of a focus on bringing vaccine to people instead of making them find vaccine? And are there any partnerships in the works to do that? It sounds like a couple were just mentioned.
Yes, I can field that question. And there are some partnerships in the works. We have not only a vaccine committee, advisory committee, and then we have a group of probably 45 people throughout of Rock County of community partners. All of us are trying to work and pool resources as far as not only the transportation, the communication, the education aspects, but also the whole vaccine and trying to get maybe vaccines out to the people. So there is definitely some groups that are have already scheduled some events that you'll start to hear about in the near future for vaccination at public sites. We're really excited about that. We're partnering with churches, with our community health systems are all partnering with various groups in the area and really reaching out to them and trying to meet them where they are.
Great, thank you. Let's see. Any other questions, Ashley? Okay. Sounds like Ashley may not have any more questions, so I think we can conclude this media briefing, kind of a shorter one for today. But in the future, if anyone is a media partner and would like to participate in these media briefings, please reach out to us via email at media.publichealth@co.rock.wi.us, and we will get you the information to be included on these media briefings. In the meantime, we appreciate everybody who is watching these media briefings on our Facebook live stream and anyone who watches the recordings afterwards. So we will conclude for today, and we will be back next week, Thursday at 11 o'clock. Be well and be safe and be healthy, everyone.